Hello, good afternoon, good evening, everyone. Welcome to PermanenteDocs Chat. I'm Dr. McDonald. You're honored to be hosting you our next version here of Permanente Chat, version 2.0. And I have to give a quick disclaimer upstart. I sound kind of funny. I actually tested positive for COVID earlier this week. My vaccine is working, so I feel fine, just so everyone knows, but I may cough a little bit and may need to drink water. But other than that, I feel fine. So I hope you're all vaccinated, anyone out there listening. So I'm really excited to talk about health equity this week with two of our amazing guests, Dr. Chavez and Dr. Willis Jacobo. So I will let both of you introduce yourselves and tell us a little bit about yourselves and your interests here in health equity. So Dr. Willis Jacobo, go ahead and go first.
Yeah, thanks, Dr. McDonald. Sorry you're not feeling well. I'm Lindia Willis Jacobo, Senior Associate Dean for Admissions and Equity, Inclusion, and Diversity at our new School of Medicine in Pasadena, California. I'm also a practicing pediatrician. I have the privilege of practicing not far from the school in the Pasadena area. I'm absolutely passionate about all things equity, inclusion, and diversity. So it really is a privilege to have this opportunity to chat with you.
How long did it take you to learn how to say your full title without
right that I think that's a really good point. I'm constantly trying to think of ways to kind of shorten it. I've not come up with anything clever, so maybe you can give me some ideas.
I doubt it, but it's amazing. You have such a big role there, so thank you so much for taking time out of your busy schedule. Dr. Chavez, go ahead and tell us a little about yourself and who you are and what you do.
Sure. Hi, I'm Sherry Chavez. My three most important identities are as a mother, as a pediatrician, and a member of the Chavez Garcia family. So I serve in South Bay, California, and I also help lead equity, inclusion, diversity for the medical group, SCPMG. And what I do, I try to make things a little bit better than how I found them. I am so excited to be here. Totally feel out of my element in a Facebook Live, but here we go, right?
No, it's fantastic. This is great. Thank you so much for joining us. It's sort of the new way we're trying to communicate as well. So I appreciate your flexibility here. So, well, why don't we just start? So, health equity is a term which is sort of thrown around and used quite a bit, especially in the past year or so. So I don't want to hear from both of you, just kind of briefly, like what health equity is and what that may look like when we eventually get there. So Dr. Willis Jacobo, go ahead first, please.
Yeah, I think that's a great question. And interestingly enough, it's something we're actively grappling with here at the school as we're kind of thinking about teaching our students. But I think when I think about health equity, I just think about, every person, irrespective of backgrounds, lived experiences, just really having that opportunity to reach their full health potential. And frankly, when we get there, what could that look like? Maybe we will no longer see the disparities that we're seeing in many of the health outcomes currently. So I suspect that is what that could look like.
So Dr. Chavez, same question. So briefly tell us what health equity is to you and what it may look like when we get there.
Yeah, thanks for the opportunity to weigh in on that. Actually, equity is everywhere. If you listen to the news, if you watch the television, anywhere, read, you're seeing this word equity. And I would boil it down super simply to when you're providing equitable health care, you're meeting the person where they're at. Regardless where that is, regardless what identity or what they're coming from, you're just showing up to meet them where they're at. And that's equitable care.
That's wonderful. I love the visual of kind of health equity with the very tall person and the short person, the child and the person in the wheelchair. And the first picture is they all have the same bike. And obviously the person in the wheelchair can't ride it. The kid can't ride it. It doesn't fit the little person. It doesn't fit the tall person. And the next picture is everyone with a different size bike. The kid has a tricycle. The person in the wheelchair has a recumbent bike. The tall person has a bigger bike. The shorter person. So we give people the tools they need to succeed. That's the visual I always kind of have in my mind over and over again. So thanks for that. I appreciate your words.
You know what? Can I add one more visual to that I just saw yesterday that I was like, that is totally it. So think of when you're seeing like a sprint in the Olympics, right? And there's a potentially a staggered start, right?
Yes.
And that staggered start it looks that doesn't look fair, right? There's someone way in the back, but ultimately they're all racing towards the same finish line. But that visual of that staggered start, we're not all starting at the same place, but we're all aiming for the same end goal. I love that. And so if you wouldn't mind, add that to your imagery of equity, right? That staggered start, necessary for everybody to have the same opportunity to get to the same endpoint.
That's
Actually,
great.
Dr. Chavez, that's one of my favorite images when I'm thinking about equity. I love that you brought that forth. It's really a good one. Yeah.
Awesome. So I think the COVID pandemic, which we're all still grappling with right now, has really brought forth and shown a light on a lot of the disparities currently right now in our healthcare systems and just in the world in general. What do you think we've learned, and is there anything the silver lining maybe of this COVID pandemic in terms of moving the needle forwards on health equity? Do you have any thoughts on that? We'll start with you, Dr. Jacobo.
Yeah, I mean, I think it definitely has allowed us all to do a lot of deep reflecting. I mean, I think what we now know, as if we didn't before, is that they're real, right? And that they're deeply structural and will require creative, collaborative solutions. So while it's not been pleasant to see, right, that level of inequity, et cetera, I mean, I think what it has done is really mobilized people into thinking deeply about these structural issues that have always existed. And it really has, frankly, exposed a lot of the inequities. So,
yeah, I definitely. Dr. Chavez, any additional thoughts there?
Yeah, for me, it pushed medicine outside of our walls, which we knew that we were going to have to go outside of our walls if we were going to start to tackle disparity. And so the silver lining is the innovation, the attention outside of our walls that I can absolutely say I'm proud of, right? Remote monitoring, digital access, those weren't issues before COVID that we were focused on because the front door was the front door. And now the front door is someone's home, someone's internet access, et cetera. So yeah, it is really sucked, right, to be in healthcare at this last 2 years. But yeah, I do have a lot of hope because what we have had to pivot and experience to, again, meet people where they're at.
Yeah, it's certainly very true. Pivoting and meeting people where they are is something that has certainly been we've paid more attention to, I think, recently, which I think is a really good thing overall. So, Dr. Chavez, maybe you can answer this next one. I'll start with this next one here. So we have a lot of sort of disparity built in and baked into healthcare in general in this nation and our health systems. How can really we work towards equity and build equity into our systems and into our physicians and the education of our medical students as well?
Well, I like that you're using the word equity when you're asking that, because I being in this space for a while, we have focused a lot on diversity, which in my, when I boil it down, it's representation, it's counting people, right? How many of this, how many are that, how is that compared to the population we're serving? And then there's inclusion, which is how do people, when they're there, how do they feel? But equity is actually the systems and the processes and the policies. And what I've noticed is that we have started to kind of look at those and find the inequity or equity. Where's our strengths? What's our weaknesses? And then dismantle some of that we know is not serving everybody. An example that I can think of is in the quality space, we're starting to look at place equity. Yet where a person lives determines really a majority of their health. And so how do we align place equity with quality data? We've always used race as a proxy, but place may be better. That's a quick thought on that.
Yeah, it makes me think about your zip code may tell you more about your health than your genetic code, and a lot of the work that's gone into that from the California Endowment as well, too. Dr. Jacobo, same question for you, maybe focusing more about educating medical students and sort of the next generation of physicians to have equity part of their education, part of the DNA of who we are as physicians and as those kind of steering the next generation of healthcare.
Yeah, I really like that question because I think it forces us to think about starting this work a lot earlier, right? And I think for the students especially, we know that they're coming into the school with different levels of understanding, et cetera. And so I think for us, we really always need to be thinking about ways of creating an environment here at the school that fosters a deep understanding, but more importantly, a deep foundational knowledge of structural barriers, right? I think one of the things Dr. Chavez mentioned is we've often used race as a proxy, and we know that it's not really how this works. And so for us, it's really starting with that foundational knowledge, that awareness, building it deeply into the medical school curriculum, so that we ensure that equity is foundational, not just to curriculum, but to everything we also do here at the school. So I think it really ends up being structural and foundational is how I would think about the work we're trying to do at the school.
Yeah, it's wonderful. I'm full disclosure. I'm really proud to be one of our assistant faculty at the School of Medicine. Full disclosure. So we have a question in the chat here from one of our viewers. So is health equity defined by the reduction of health disparities, or are there other meanings that we may take? Dr. Hokobo, why don't you go first with this one?
Yeah, I can start with that. And I think for quite some time, we often referred to these issues as, health disparities. And when you look at the definition of disparities, it really is just telling us there's a difference in outcomes, right? When we really think about inequities, what we're really saying is there's a level of injustice to it. So it really allows us to put a social justice lens to the work. So though these things are related, they're not exactly the same. So that's kind of how I think about, and we're kind of moving the language a little bit from health disparities to health inequities.
Great, thanks. Dr. Chavez, any other thoughts or comments on that one?
Only to add that in KP, in an enterprise-wide way, we're looking at health equity, and that it has a quality outcome measure, but it also has this concept of inclusive care. What does that look like when someone's in the room with you or accessing our system? So it's more expansive than just the health disparity, like Dr. Willis-Jacobo mentioned.
That's great. And maybe another question from the chat that just came in, and this might be great for you, Dr. Chavez. What are some ways technology can leverage or to support equity? Because I think within KP, we have a lot of support tools which can help sort of make sure our own kind of inherent biases aren't portrayed in the way we carry medicine, deliver medicine as well.
Yes, and so quick example comes to mind. Health Connect. There is so much that we can know about a patient, that we can ask about a patient, that we can capture about a patient, pronouns, their sexual identity, their gender identity, their place of employment. All of these things build a more complete medical record for a patient. That's one thing. Geospatial mapping, understanding neighborhoods that people are living in, associating quality data with that, finding the places that are most vulnerable and the most under-resourced and going there and serving and be strategic about that. So those are a couple examples, but absolutely technology matters. The digital space, the access or not access that different populations have to that, making it more convenient, et cetera. I mean, the list goes on. It's exciting, right? It's exciting.
Dr. Willis-Jacobo, any thoughts on the technology piece and how it can assist us here in this effort?
Yeah, no, I love all that Dr. Chavez has just talked about. The only piece I would add, and it's something that KP has done for quite some time, is just being able to get to patients, patient care, right, through telemedicine. So being able to get to folks who may otherwise not be able to get out there and access care. So I think that's one of the areas we think about quite a bit when we're teaching our students, for example, rural areas where patients otherwise may not be able to get to a clinical site or a hospital.
Yeah, I think it's really important actually too that when we do that, I was actually just looking at some data regarding access to telehealth and video visits and
Right.
the disparities in terms of rural versus urban
Right.
with bandwidth, and then also people who have
Right.
access to a computer and home internet as well. And there's a lot of racial and socio-political barriers there as well too. So in our effort to become equitable, we sometimes uncover additional challenges too.
True.
Awesome. Sorry about the dogs in the background. I apologize. So I have a question here in the chat, and then also I have one of the things I wanted to touch on a little bit here. So we've heard a lot about social determinants of health, and how do you think equity and social determinants of health intersect? Are they part of the whole? How do you envision those two concepts together? We'll start with you, Dr. Chavez.
Yeah, they're linked. There's no getting around that. Social determinants of health and health equity are linked. And that's the best part for me. Again, going outside of our walls, it is absolutely clear. I'm going to misquote, but I think it's 70% of our health is determined by things that our doctors don't do, right? And I think we're poised to start talking about that. Medical legal partnerships, medical financial assistance, food insecurity, ACEs. I mean, there is so much that if we don't start talking about, don't start embedding into our practices, we will never obtain our aspiration of health equity for all.
Yeah, that's great. I think it's even higher. I've heard studies as high as 90% of your health is determined by things outside of medicine. It's probably somewhere around that 70 or 80% range, honestly. So, Dr. Jacobo, any thoughts there in terms of how you construct social determinants of health and health equity and how those two intersect or overlap?
Yeah, I completely agree with Dr. Chavez. I mean, they're fully interrelated, right? Structural social issues direct effect on creating these health inequities. And I think Dr. Chavez mentioned quite a few of them. I would add income, social status, racism, and a whole host of other determinants that we're becoming increasingly more aware of, and the negative impact it has on one's well-being. So, yeah.
Yeah, definitely true. So we have a question in the chat, Dr. Chavez. You talked about moving outside the four walls of our hospital. And I think this right here is a great example, doing a Facebook Live. We're trying to help take these ideas and concepts and spread them beyond the traditional four walls of the hospital and the clinic. Do you have any other patient stories that you could share? I think one of the questions was asking if there's something specific that you can think about, or some story that really that kind of epitomizes moving outside the walls of our hospital or clinic.
COVID vaccine, right? So I talked about geospatial mapping. And so what we did was say, okay, based on the level of vaccination in communities, where are we predictive to not meet our threshold of 70% vaccinated? We could do that really early based on the trends that we were seeing. So easy to do, geospatial map, identify hotspots, identify those places that are going to happen, and go there. Take the mobile vehicle there, extend hours, go to the employers in the area. Again, it's equity work. It's meeting people where they're at. But the first thing that we, for the first time, said, who is that going to be? And how can we predict and get ahead of that and put those people in the front of the line if they want the vaccine to have it? And that won't be at our medical centers. That will be where they are.
Yeah, that's a wonderful, wonderful point. Dr. Willis-Jacobo, this question is for you from the chat here. So can digital therapeutics help medical students address inequities?
Yeah, I guess I would want a little bit more clarity on the question in terms of digital therapeutics.
Sure.
Yeah.
I mean, I'm not, maybe I could, this is my interpretation, maybe thinking about how, again, home blood pressure monitors, home video visits, things like that, using technology to kind of bridge that divide and bring care into the patient's home specifically. That's kind of how I'm thinking about it.
Yeah, and if that's the way, I would argue absolutely.
Yeah.
I was like, are there digital pills? I'm interested. Tell me.
Same thought. I
Tell me
thought
more.
I'm absolutely stumped. Digital therapeutics, but I like that.
Wouldn't that be awesome? I think we should do that.
Right. This is
right?
good. I like that, but that makes sense. And yes, I would absolutely agree that it would be helpful.
Yeah, I thought maybe you knew something and I didn't, but I want to make sure that our viewers kind of get the information they need as well.
Absolutely.
One of the nice things to have a little bit of give and take here. So, all right, we're getting close to time here. So let's finish with this. Maybe one more question. We could go on and on for hours probably, but we're trying to keep these short and high yield. So, maybe tell us maybe your top 1 or 2 things that some of our viewers can do to help promote equity starting today, tomorrow. What is like 1 or 2 things that people can really kind of try and do on a daily basis to move the needle? Because I really think it's going to take all of us, quite frankly. So Dr. Jacobo, you can start with this one.
Yeah, I think awareness, I know that sounds really simple, but I think awareness and getting involved as much as one can. There are any number of amazing books out now that are super helpful in terms of kind of getting us thinking in this way. There are a lot of podcasts. I'm a huge believer in being able to share broadly. And so I would say kind of just becoming aware that these exist. And acknowledging them is certainly, I think, from my perspective, a really good start.
Yeah, absolutely. Dr. Chavez, what are 1 or 2 things people can do starting today or tomorrow to help in this effort?
Yeah, well, as care providers, I would say knowing the person that's in front of you, asking those questions you might not ask. What's your job? What's your family situation? What's your support? What matters to you? That simple question is so insightful in my exam room when I take the time to ask it, right? So trying to get back to why we're doing this, why we're doing medicine. And that's the connection and relationships that we build. And I know I can be a better doctor if I know who's in front of me. Mm-hmm. So just that simple question. And maybe document it in the chart so that the next person can use it. It's this building of these structures that will help us to be better to each other, to see the person in front of you as human, no matter what, where, and how they're presenting to you. So it's an easy thing, I think.
I love that. And it's something I try to do on a regular basis, is just one little thing or one piece of small talk. And it really, honestly, it makes me get more professional fulfillment out of the visit. Also, the patient isn't just a widget in front of me, it's a person. And really reinforces that too. And so I think that's, it benefits the patients, and I think it benefits us as physicians as well too. So I thought I might add my own 2 cents. Okay, last question, then we got to get out of here because we're over time. Dr. Willis Jacobo, what is the one thing that makes you most proud to be a Permanente physician?
Yeah, great question. I'm a brand new Permanente physician. I practiced elsewhere before. So I would say for me, it's just been a privilege being part of such an incredibly committed group of folks. And I think I've been incredibly impressed with how committed just the Permanente space is truly to equity, inclusion, and diversity. And so that for me has been pretty amazing.
Wonderful. And Dr. Chavez, same for you. What makes you most proud to be a Permanente physician?
Our mission. The last phrase of that is for all the community, for all of our members and patients in the communities we serve. So I've always been driven by our mission. And I do believe collectively that we're trying really hard. We're leading in this space in particular. So that's my there's where my pride comes from.
Awesome. Thank you so much. Well, thank you both so much for the time today. Yeah, I know you're both incredibly busy, and we really value this conversation. And we hope you join us. Our next PermanenteDocs Chat is, I believe, in 2 weeks with Dr. Zucker talking about mental health and COVID, which is another small topic, but looking forward to that. So please tune in again, watch your Facebook or your Twitter or your Instagram feed for that. And we'll see you all soon. Thank you so much.